Awesome.
Okay. This is so exciting.
Yay.
Um, this concept, and I know it's true for you guys, has just been in my mind for years. And it's just mulling over every day, like knowing something like this needs to be developed. And meeting you guys over the last couple of years at different conferences and stuff, it was so good to meet people that thought the way I was thinking as well and have practices like I really wanted to build and grow. And what that is really this like white space in the industry that I feel we're going to take over. I mean, we're just going to take over like a storm. Like this is the forefront of everything. And let me just I'll just mute this and there it is. And what that is this whole concept of this health optimization and human performance. And we all have our own different experiences and stuff. We should talk about it where like we know about health optimization, prevention, and we've worked in modern medicine so long and we see what happens when reactive medicine just kind of waits and watches and sees what happens. And that's really drove us to build our own practices. Each one of us have our own practices. And looking at everything from blood work to hormone optimization to weight loss to muscle growth and all the things. And we know that we couldn't do it ourselves. Like we don't need to be a full jack of all trades. We can
Right.
really hone in on our own expertise. And we've really worked with and known. And Justin, you've been a CSCS, so you fully know the whole situation of pulling in
Sure.
uh, coaches and trainers to be able to help clients actually like meet the medicine halfway is what I often say is, the diet, lifestyle, the foundational factors that you can't build a great protocol on without having good foundation, which diet, exercise, nutrition, sleep optimization. And those are big topics we talk about with clients every single day, going through, like for myself, going through their blood work, going through just their symptoms or their complaints, and having coaches in there or someone else helping us like get our clients to their highest self throughout their programs when they work with us. And a lot of that has been like coaches and trainers to build training programs, nutrition programs. And a lot of it is, see what you guys think too, is like a lot of it is helping people. They know what they need to do. Like they know they need to eat protein, they know they want to exercise, but it's the value of like the coach that can spend time with them on top of the provider is because they can help them figure out how to strategize it into their daily life, like how to habit stack things. So actually things can be like done completely and improved upon. So um like when what we're saying about this I guess what the name of the Society of the Health and Human Performance Medicine is like this new branch of medicine that we've all thought about, we've been working in, but not had this like actual name or community that we can really claim. And I've always said I'm in the middle of like conventional medicine, but functional medicine. Like I'll talk to you about cholesterol lowering medications, and I'll talk to you about like different like things that like functional medicine do, some testing that they do, but we're going to kind of work in between and pull from the best of the best. And I feel like that name really is what we're building, what we're at the forefront of is that Society of Healthy Human Performance Medicine. But I could go on forever about it, so I should stop real quick and see if you guys want to add to that or anything too.
Sure. I mean, of course, we all kind of, you know, see the importance of the exercise working with, or whether it's working with a health coach or having someone else on our team as medical providers, right? Personally, right? We all take great part in our health and our wellness and eating the right things and nutrition and, moving our bodies. But I think the health coaching piece definitely, it's in our training, right? Traditionally, it's totally, I mean, we had what? Nutrition, maybe a few hours of nutrition in our training. So I think this is great what we're doing.
Yeah,
Yeah.
connecting the dots
Yeah, I
for
think
sure.
working with a coach can be pretty much an extension of what we do. Because
Mhm.
if you think about how much time do we really get with clients? And I'm sure all of y'all spend a hell of a lot more time with your patients than, the traditional insurance system where you get 7 to 12 minutes. You see five
Right.
people an hour. I'm sure y'all are easily spending 30 to 60 minutes, just right
Yeah.
out of the gates with your clients.
Mhm.
But still, I mean, what's that come out to? A handful of hours per year. So
Mhm.
having a coach who can keep the ball rolling is
Mhm.
important to keeping those patients compliant long terms.
Right.
Again, I mean, there's only so much we can pack into a single appointment. We can cover the bloods, cover the symptoms, cover the treatment, cover, the expectations, the prognosis, et cetera, et cetera, et cetera. But we don't really have time. We can't be in the trenches with them every single week. And I think
Hmm.
that's where working with partners who have a working understanding of what we do, that can complement what we do, can really just carry forward and reinforce our programs. So yeah,
Hmm.
I found that working with strength coaches, working with traders, nutritionists, I think that complements what we do quite well.
Right. Right. And I think
Absolutely.
that's what it takes is collaboration. I've always felt collaboration was so important. Even in like, even when we worked in the conventional medicine, like when I would work in the hospital setting, like we needed like the physical therapist, we needed the occupational therapist, we needed the nutritionist, we needed like ortho, we needed cardio, like we needed all those different types of people for a client. Like when you'd collaborate with them, like respectively, then it worked out better for the patient. So same similar aspect in the proactive side of healthcare where, we'll work with physical therapists, with occupational therapists, with chiropractors, with coaches in a more collaborative approach because our goal is to help the client be successful at the end of the day. And when we work together, despite who that is from a proactive standpoint, it just is more beneficial for them. And when you have that mindset, it's not like a competition. It's more of like, okay, what can we do to, make this person feel better at the end of the day? And even like from a provider standpoint, from the primary care doctor, like I don't feel like I'm in competition with the PCP because I understand like they really only have 7 or 10 minutes. Like they don't they don't completely choose to only have 7 to 10 minutes to see their clients. They're like forced into that because of modern like insurance companies and like they have to meet these certain metrics and everything. And I understand that as well, and I never want to do it at all. I would never want to be in that, but I can help them. Like send me the client, I'll optimize their testosterone. Let me get their A1C down to like actual like very good levels. Like let me get their A1C. Like the last week I had somebody who had an A1C of 9.8 and she worked with me for it's been 9 months and it's down to 5.2 and it wasn't just a
Damn.
GLP-1. It was literally like
Too
diet,
much.
exercise, protein. My coach is working with them to like,
Right.
hey, how'd you do with your protein? What's going on with that? And it's just having them think that way. Maybe they didn't meet their metrics, maybe they didn't meet their macros every single day, but the change in the mindset to help them feel more in control. I always say like back in the driver's seat of their own health. Where now she's going to go back to her PCP 5.2. They're like, what'd you do? Like, yeah,
Wow.
we went and seen a proactive healthcare, clinic there. And then that only builds that respect. And I think this is why this is so needed because even after like the pandemic and stuff, people have lost trust in modern medicine and they've gone to like coaches who some coaches are amazing. Like they're so good. I highly respect them. But there's also ones that are like selling every single peptide under the sun and the clients don't know what to do. They don't know who to trust, who believe. They go on social media and it's so much noise. And I feel like what I want to accomplish with this type of practices and this type of society is a little bit of a muting of that noise and helping them gain control and a pathway in their own health and to add more life to their years because it's completely possible. It's within reach. People are completely capable when they have a good solid team around them. And I just don't think maybe there's out there and I keep thinking like maybe I'm missing it, but I don't see this built just yet. And I know there's hundreds of providers out there that think this way too, and really to pull them together would build such noise, such a voice that clients can hear and be a part of. And it won't be something like, oh, they're just going to a TRT clinic or they're just going to like a functional medicine stuff. They just put you on supplements and everything. When no, we're an actually legit health like we went to school for years and years.
Right.
Like we went to school for years and like actually did clinical and we know what we're doing, but we also value performance in
Correct.
how well you perform at the gym, how well you perform at home, how well you perform at your office. Like building
Right.
that resiliency and the capacity for our clients is so rewarding.
Yeah.
Um, but that's why I feel like this has just been something that's been working on for a long time. I think you guys kind of felt this too for a while. I don't know if
Yeah.
you guys had a hard time finding a word. I like to be able to like
Mhm.
define something.
Right. I think it's working in a hospital, like my background working in a hospital, we see how medicine traditionally is so siloed, right? Like everything, it's the cardiologist, they only care about the heart and the medication with the heart, but they're not taking into account how whatever their interventions they're doing, how it's affecting the kidneys and it's affecting the lungs. And I think as nurse practitioners, our ability to connect the dots is so important, because we see things like the big picture, and we always treat the entire patient, right? We always look at the entire patient, not just one specific system. So absolutely, as a nurse practitioner, we can integrate both worlds, right? Like we can check hormones, we can look at people's metabolic health, cardiovascular health, but we also are interested in their nutrition, in their sleep, in how are they functioning, how are their relationships, right? How are they performing in every way? We just want to help people, I'm not interested in keeping someone alive for 80 years without helping them to perform their best every year as long as they can, right? In every way, both health, nutrition, independence, relationships, everything, right? So I think this is important. Yeah.
But getting them to work out and lift weights and eat right is probably the simplest streamline to get them to live 80 years.
Right.
With healthy, productive lives.
Absolutely. Absolutely.
I think we definitely been trained to overlook that. We just reflexively been trained that if somebody comes in with a symptom or a problem, they have to leave with a script. Like the amount of times patients would leave without a script and think, what the hell am I doing today? Like, why did I make an appointment with you? I think it's gotten to the point where medicine's a bit transactional. Like even the
like
internal
a vending
medicine
machine.
world. Yeah, like if you go to the point where you're like, I gotta leave with something. If you leave without something, that's what's wrong. But no, that's what we want. We want patients to be able to say, hey, I went to my PCP, I went to my IM, and they said, go home. I'm great. I'll see you in a year. There's literally nothing. I don't need scripts. That's the goal, is to get
Right.
people.
Like how cool would that be?
That's the goal. But I think we've been so trained in medicine that as even as like patients, if they leave without a script, they think there's something, they didn't get something. But in fact, that's an A on your report card.
Yes.
And that's where people like us can really fill that void, I think.
Right. And I think it comes from both perspectives, because it is like overlooking it and be like, I need to fix this. And like, I need to give you something to help fix it. Like, okay, if you have high blood pressure, let's give you some high blood pressure medication. And I think the other side of that too is like, I think like as a society, as a population, and I hope that's kind of like leaving the populations now and the generations to come, because I think it's definitely a lot more important now for people like in their 20s. They're all getting their blood work done. It's the cool thing to do. It's trendy, which I love so much. And that they're looking at all the restorative stuff and health optimization side of things, that like in the past generations have been like, yeah, I'm probably not going to eat protein. I'm not going to work out. Like, what can you just give me?
Oh yeah.
And so it's like comes from both sides. It's like, because it's like easy. Like everyone knows, like even my 10-year-old, he knows like I should eat protein. I should like be working out. Like if I ask him, like, how do I stay healthy? Even kids know what to do, but it's like that actionable thing. And it's like, well, sometimes they just go too far behind the 8 ball, and here's your statin, here's your hypertensive medication. And then the provider also gets blamed for like, hey, they're just handing me scripts. But no, like you literally didn't meet the medicine halfway. You're smoking still, you're eating like crap. Like, and that's the type of average person that this type of like industry, like this branch of medicine really can influence and change that mindset, because it is completely possible. And once you help somebody build the capacity, like optimize their testosterone, help a perimenopausal woman with some progesterone and they can sleep again. Okay, now they have energy to work on their like protein goals. Now they're seeing some progress. You put a male on testosterone that really needed testosterone, their life can completely change. It is like I can't even believe the changes that men can make just with some testosterone therapy. It's just so impressive. And once you can give them that capacity from that medical standpoint, then they oftentimes can like perform and go to the gym and have that energy to do all the things that we're hoping for. And sometimes it's the opposite direction. Like, yes, optimizing sleep and things can help the hormones and stuff. And that's why it can't be like, it has to be intertwined. Sure. So like, that's what this type of collaboration and everything seems to be the right direction to take.
Yeah,
for sure. So definitely it's a need. So I love that it's like the Society of Health and Human Performance Medicine. Thank you, Justin, for helping me get that out there. Like the society, I was like, yeah, that's perfect.
I love it. Society, the society.
Yes, I like it.
Members only.
a really cool gang of pretty badass people.
Yeah.
So I love it. And the goal with this is just to kind of get more recognition of what we've been talking about, because I mean we could go on and on for days about it, and I'm sure other providers feel the same way. And just building a lot of steam, like my goal in the next like 90 days is really build a lot of steam behind this concept and build it up, and then launch it out to see where I want to. Another part of this too is like having a place that like coaches are like, I don't even know who to send this to. Like, how do I have more Nicoles and Justins and Jessicas across the country to like actually send people to? Because yes, we're licensed in several states, but like, I don't know, like with you guys, I don't really want to be licensed in every single state because it's like a lot of regulation. Like even to
Oh, it's a lot
prescribe
of upkeep.
testosterone, it's
Sure.
crazy, right?
Yep.
Yeah,
Yeah.
it's a lot of administrative headache.
So much administrative headache and everything. And could it be possible? And are there online telemedicine clinics that do that? Absolutely. I mean, they have 50 states. You can see everybody in 50 states and it's fine. I like that we still have the like person to person contact as well, because like within the days of AI, and AI is the worst it's ever going to be right now. It's only going to get better. That human interaction, I really always want to maintain some of that contact. And I know that can be hard when you're spreading really thin over the whole entire country. So finding people, and we can really build this like directory of providers that think like we think, that are credible, that like have the same collaborative mindset, not to like take over the whole entire thing, but just like that collaborative mindset of coaches, providers, to connect together. Like who's in, like I'm in Michigan. Who's in Michigan? Like, yeah, Jessica's in Michigan. Nicole, you're in New Jersey, but several other states, mainly in New Jersey, right?
Yeah.
And then Justin, Tennessee, right? Tennessee and Kentucky.
Tennessee,
So like,
Kentucky, yeah.
yeah. And then Carrie Miller, she's in Alaska. So like we have like a good crew even already, but over the next 90 days, I really want to build that momentum of people that think like we think. And then as we do that, like build out, who knows, like CMEs and like conferences and a lot of like power and voice behind us. Because as an example, I don't know if you guys know who like Andy Gelpin is and like Matt Walker.
I've
They
heard
are
of
really,
Gandhi.
yeah, I mean, they're really into the sleep clinics. Andy Gelpin has a great podcast called Rapid. Is it Rapid? I think it's Rapid Optimization. I love listening. I always listen to podcasts all the time, right? And like they built this sleep ring, and it's like a 3-night sleep ring that clients can utilize. It's actually like FDA approved. It can diagnose sleep apnea. And it's such a really cool tool that like we could all utilize and share those interesting, like not interesting, but really valuable tools that
Love that.
other clinicians can use,
Yeah.
and even some power with the pharmacies, because places like that have these 50 states, like they might have more power of voice behind them to get better pricing and stuff at,
Some GPOs for sure.
yeah,
Sure.
at like compounding pharmacies, where it's like, hey, like there's a whole group of us that like, we have a lot of buying power, and getting behind that only benefits all of us. And then also that only trickles down to benefit the client at the end of the day. So,
Yeah, better margins for sure.
oh, for sure, 100%.
Yeah.
And then I think from like you guys, how do you guys have or incorporate other like other professions in your business? Like, do you guys have coaches in your business? Do you guys collaborate with them outside, or what? How do you guys currently do that?
For us, we collaborate with other coaches outside. There are many, I have probably about 5 or 6 that I collaborate with, and it really depends on the type of client and who I think they would be the best fit for. Because, I have some that I think might work better with men, some may work better with women. I have some, depending on location, there are a few that, and I think some of my clients benefit from working in person with people as well, right? Like I think many in the past have been, it's intimidating for, new 55-year-old women who have never stepped foot in a gym, and we're saying, okay, you have to go lift weights. Let's go lift weights. I mean, it's intimidating for them. So an online coach for some of them maybe isn't the best thing. So then I will place them with someone in their area that is local and does in-person training, even just to get them started, not to continue, but maybe we'll do like a 3-month like introductory program. So they'll meet with them like once a month for 3 months, even if it's just once a month, and shows them, a multitude of exercises, and they're able to carry it on, to perform their program themselves. So we do that a lot. And it just depends, really, the location and the personality, who would fit best with who. But we refer them. So how it works is we'll see the client, we'll talk to them in great depth about the benefits of, strength training, of course, and nutrition programs, and then we will pair them with someone that way.
Oh, that works out well.
Yeah.
That works out really well.
Yeah, same concept here.
Same
We have
concept.
various levels, various tiers, that experience levels, preferences, all that. So we definitely have plenty of it. And I even work with one of the other guys that I refer people to, just because, I can give firsthand experience, um, it's kind of like, if you know their style, you can kind of match them with people better, with their personalities. You know who's going to fit with who. But yeah, totally same thing. We have a network that we work with.
Absolutely. And I think as a clinic, like having like that connection with your community is great. So like having the in-person trainers, and they see somebody that's like they're making progress but not full progress, and they're like, hey, I know a place to refer you to, and making that connection. Even like connections with like, even I've talked to like dermatology offices around where I'm like, hey, like I really want my clients to get a whole skin evaluation every year. Like, can I, like not that I like send them to one person, because there's like all the issues with like not like there's no pay for anything. It's like, hey, I know this great person. I like their business model. I like how they present or how they treat their clients, and then refer them over there because I want my clients to have like a yearly like skin evaluation. And so having that community, talking with them, being like that boots on the ground, like integration into your communities. That's why I like, even that's what's missing with telemedicine. Sometimes I like telemedicine because it gives a lot more access all over. But I also like that access of like building in through the community. It just is a little more roots. And so like when it's really rooted all throughout the whole country, like that's really going to give a lot of legs to this concept over time.
Yeah.
But I like that process. Even like the dentist talking about like oral appliances for CPAPs, or like for like sleep apnea, or like that have like maybe even like the pelvic floor therapist. Like, do you guys connect with people like that too outside of your offices?
Sure.
Mm-hmm.
Yeah,
Yeah.
too.
Even like yoga folks, man. But there's so many dudes that try to convince started yoga and Pilates just for like pelvic health, pelvic health.
Yes.
Or, especially dudes with like BPH or sexual dysfunction.
Yeah.
I tell them the importance of like getting off your ass and just stretching. You'd be surprised
Moving.
how much difference yeah. Because you know how most dudes are. Most dudes are like, I know how to lift weights, I know what I'm doing. But in reality, they really don't. They just think they do. I mean,
Yeah.
real talk, most dudes think they do, and they have made progress in 3 years, which
Right.
Absolutely.
shows.
And then when
Yeah,
you can,
so I
when
mean,
that,
Yeah.
sure. And when that comes from their provider like you, and you're like, hey, this is okay to go do this. And like they probably never would have signed up for a yoga class, but like because you like said, no, this probably is a good idea. Like it brought
yeah,
business to that person, but also like progress for that client as well.
Yeah.
I think it's great stuff. I believe it
Great.
100%.
Mm-hmm. No, I think it's perfect. And I think we get that from like the nurse practitioner. I think in general as a profession is just more collaborative. I mean, I can't say much about PH because I haven't really interacted with a lot of like physician's assistants, or like I don't really know much about that side of it. So I'm like more biased to NPs, or know more about that obviously, but I think we're just more collaborative, and like we are really working together for the client's like overall goal, from working at the bedside with them. Like, when you're there and you experience their sickness and illness, like you want to be able to preach to them way before you have to preach to them at the bedside. And this is how we're doing that with them in everyday practice, which is I think it's like very rewarding. But and then I guess in my clinic, I kind of have a unique situation. Like my business partner, he is another nurse practitioner. We like during COVID, like we're in there with our PPE all over and like everything. We're like, how do we get out of this? We can't keep doing this. And so like
Right.
we like created like LIV1 doing this. And then our partners, our spouses, basically like they are coaches. Like it's both of them.
Right.
Like so mine for Tim, and then Justin's Kate. They're both coaches, and it just worked out like to have them here. And it's very hard to probably have a coach in an office setting, because then you have to like pay them certain things. They just kind of get whatever we can because they're like supporting the business. So like it can't work in every clinic, but thankfully it
Right.
kind of worked for us. That's why I like the collaboration so helpful. But yeah, when the client has everything together, it's just a world of difference. Like for the men, a lot of times you'll optimize their testosterone, and just do you guys have an in body or anything in your office, or do they measure anything at home, or do you measure like skeletal muscle mass or anything somehow, like a DEXA scan or something?
Yeah, we have a Staiku machine, so it's like a body composition scanner. It does. It also checks like their bone density as well. And I like to, yeah, does their bone density. It's interesting because it's different though. Like people will say, I just did the in body and I'm 15% body fat, and then they do the Staiku and they're like 20, 19, and they're like ah. But to me, it's more using the same tool and measuring your progress that way, right? So I will tell them, this is your initial, and then in 4 months when you come back and do the scan, then we can really see your progress using the same tool each time, right, to measure the outcome.
Absolutely.
The repeatability factor of it. Because, I mean, as long as you're going down on any device, it doesn't matter. You're still going down. That's
Exactly.
Right. I mean, if you get a good old like measurement tape out, that's probably still the best thing to, what is that thing called? Just like
calipers,
the caliper. Yeah, the calipers.
a little caliper.
I mean, if you get those calipers out, those are probably like the best tools at the end of the day versus anything else. But yeah, I have an in-body. I wish I wanted DEXA. Maybe that's in our like LIV1 3.0 version, but we have do you guys have any like, I always order images. So I'll order like a CAC. I always want to make sure my females and male, they have a CAC or a CT angiogram to look at the coronary arteries. Yep. So I make sure like that's part of their like legacy metrics. Like in our first years, like I want them to be able to have a CAC score. I want them to have a DEXA scan if it's appropriate, or a CCTA. So we have like a localish, like it's called RMI. It's like a regional medical imaging center. Do you guys have like local imaging centers that you refer to? Because that's how I have to get my DEXA scans right now.
Yeah, it's like $40, something like that.
It's so cheap.
Nothing.
Yeah. 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 Super cheap. And there's sometimes they'll have like, some like portable ultrasound to do like a ultrasound of the aorta and everything. And just trying to like connect with them, get that done. At Silverback, that was one thing that I really valued from the people that were there. Like for Dr. Twyman's group that was there, they had like the carotid intima testing. And I really wanted to have it in the office. It's just I would have to have another person, so I can't have it quite yet. But like they have the cardiac insight patches that they were talking about, and it's like a 7-day patch that our clients can wear. And it's something that it wouldn't tell them right away if there's like a arrhythmia, but it'd be something that they can use that can, if it's off, like if there's an arrhythmia identified, that it would give them a little bit more recommendation to go to cardiology. Because a lot of these people,
like a halter?
It's just like a patch. It goes right.
But it's a patch, so rather, it's similar.
It works like a halter though.
Exactly.
It works like a halter.
Yes.
Just like a halter.
That's cool.
It was actually really cool. And part of it's like, could they go to their doctor? Could they go to cardiology and have it done and have their insurance covered it? But like in my population, I don't know if it's your population as well, likely is, they're like not wanting to go to cardiology. They're not wanting to go to their PCP. Like they're like totally not wanting to do that. So if they're like, hey, I have like these heart palpitations going on and like I have this probable sleep apnea, you almost have to like pull them along and be like, hey, like, okay, we did the 7-day patch. It's telling me we have a little bit of like palpitations. We're having some PVCs, like, and we know that knowledge from our history of like being in the clinical setting that like, okay, we know enough that let's gather a little bit of data. This lets me like encourages us to go to cardiology. And I've worked with like other cardiologists in town. I don't know if you've connected with cardiology in town, or close to you guys. But I mean, if Dr. Twyman was closer, then we go to Dr. Twyman, but he's a little further away from us. So like local cardiology, and I don't know, but have you guys noticed like cardiology is very supportive of like this type of practice? I feel cardiology is the most supportive. Do you guys feel that way too? I haven't noticed that yet. Maybe I
haven't noticed it yet.
I just have a really good cardiologist close to me.
Maybe the younger ones, not the older.
Right. Always the younger ones for everything. The younger OBGYNs are supportive. But
I feel like they're more open. Yeah, I don't know, maybe it's just but he will send a lot of clients back with 40 milligrams of atorvastatin, and I'm like, just wait a second. And then like we fix their ApoB and stuff, and he's like, okay, we're good. But it just like gives them a little bit more like, okay, momentum to go and get some things checked out. And because I feel like they've lost some trust in modern medicine since like the pandemic, and then trying to figure out what to do. They go online, they can't even drink water because there's some contamination. And they don't know what supplement to do. And there's 30 different supplements about cortisol out there. And the cortisol is the worst thing ever, So it's do you guys see that too in your office, or is it just me?
Yeah. All the time. I have clients, they bought, I had a woman recently, she had bought something online from somewhere overseas because she said, my cortisol's high. I know it. I know my cortisol's high. I'm like,
Yeah.
no, we probably just need to increase your progesterone a little bit, really, is what the issue is. But instead, she purchased some liquid she was drinking, and it came back. Her LFTs were through the roof. Her hormone levels were in the gutter. I'm like, what are you taking? What's happening?
Was it dose? I bet it was dose, DOSE. I feel like I've had a couple clients that their LFTs are really elevated.
I don't know what it is.
The liver healing drink, the little shots of dose.
Yeah.
Stuff before.
I was like, what? And she's like, now my hot flashes are back and my night sweats, I'm sleeping worse. Yeah, because whatever you're taking is blocking your hormones.
It's blocking the hormones.
Exactly.
It's all soaked up. If her LTs are high, she's probably pumping out SHBG.
Exactly. Through the roof.
Metabolizing.
Yeah.
Completely. And it's sad because like they're trying to spend money on the wrong thing. They're trying to help themselves. So it's just like they're wasting all this money on the wrong things.
Well, education Google, or education TikTok, it's like
exactly. Oh, TikTok. And the new TikTok with like magnesium or something. Everyone's doing magnesium, which I think is a good thing. Like people need some magnesium, but I think that's a new trend. I don't know. But do you like my client population is like 50, almost like perfectly 50-50 male female ratio. What's your guys' ratios just about?
I'm mostly women. I'm like probably like 70-30.
Yeah.
I'm 100% dude.
100% male, right? So you're like, no, nobody's coming here with some random thing.
I hear what y'all are saying and what y'all are talking about. I'm like, we're staying dudes only.
Yeah.
I know.
Exactly. Justin is going to die on that hill, though. Like he's been saying that for years.
Yeah.
He's not going to buy.
Stay dudes. No, we've tried the female thing before. No.
Yeah. Sometimes
I'll gladly send them your way.
That's great.
Some days I'm like, oh my gosh, like it'd be so much easier to get men, which sometimes it is, sometimes it's not, but it is difficult. It is difficult.
A lot of dudes, I just have to tell them to sack up, quit being a pussy.
I know. I really want to say that. Like, I want more, like, I'm always like, I need more big Tate energy here. Like, like Andrew Tate energy. Like, let's just do this stuff and make things happen. And
yeah,
I'm like, oh, because our different coaches, like Tim's like the big muscular guy for the coach. And so he's more like abrasive and Kate is more like meek and a little bit more mild, but she'll still get after it. But like, I have to like pair my clients with like which one I think will respond better sometimes, which I'm like, everyone just needs to respond to like that. Let's make this happen. Like, let's not waste any more time. Right. It doesn't work for everybody, but I don't know. I'm weird. I'm in the gym listening to like David Goggins and like just trying to make things happen in Jocko.
Militant style.
I am just like, let's go. Let's make it happen. Like, who's going to carry the boats? And I'm just like doing that. But I don't know.
I love it. I love the energy, guys.
I know, right? It's right. But I think one cool, like for female wise, like one cool thing that I noticed for like this female, she's like 61 or 62. And she came in, she had osteopenia on her DEXA scan prior to coming in. And we started on hormones. She hadn't been on any hormone therapy. So we started on hormone therapy, that and thyroid, because her thyroid was really messed up too. And she worked with our trainer who did a lot of resistance training, and we repeated her DEXA scan, and like it totally improved. Like she went from osteopenia to oh my gosh, I'm saying it wrong. Osteoporosis to osteopenia. And so she's like continuously improving in this like less than year time frame. I was like, this is really cool just to like have that actual validated like imaging to prove like, yes, this is working. Helps the client stay on track really, really well too. But same thing for men and like those in-body scans or whatever, they feel stronger in the gym. They feel a ton better. Like that just reinforces their progress so much better than just like a yearly exam with their PCP.
Right.
Yeah. Those non-tangible benchmarks. Because sometimes they'll be like, I don't know if it's, sometimes the new normal is it feels great, but the new normal, sometimes you get blinded by that. It becomes a scotoma. You just don't notice anything once you're normal. So having those non-tangible benchmarks can reinforce, hey, this is working. I may not feel that honeymoon, but I know on paper it is definitely working. I'm definitely getting better.
Right. How many people have you had that go on HRT? They feel great. They feel amazing. And then like 3 years in, they're like, I don't know if I want to do this anymore. And you're like, well, they don't remember what it felt like to felt so crappy before. So then I've had a few go off within a month or two. They're like, oh no, now I remember. No, I don't want to be back there. And I think it's interesting because we talk about like biohacking or optimizing yourself. It's like, where's that ceiling? And we're the kind of people we're always like, okay, but could you feel good? But could you feel better? Can you feel great? And then we want to go better, more, but more also isn't always better. You reach that ceiling, right? Then you get people to that glass, to that ceiling, and sometimes you go overboard and they're like, I don't feel as great anymore. Okay, let's back you down to where you felt great. So I think,
Find that sweet spot for
yeah, it's a sweet spot, It's so different for everyone. So.
Right. And like, they don't want to you don't want to peak, because if you peak, then you start falling back down. So it's just like continuously getting better every single year. There's some new obstacle that they need to kind of accomplish, and maybe their protocols need to change a little bit, or maybe their goals change a little bit. So you're there to kind of help support them through that.
Yeah.
And I think a lot of the patient populations that I see, and that we likely see in all of our practices, is generally 30s to 40s to 50s. Is that kind of your general male?
Yeah.
It's that. I think it's someone referred to as the sandwich generation, because they're taking care of their kids, taking care of their parents, then scaling in their businesses, or scaling in the corporate ladder. And there's so much stress there. And I had a male client, and he really came in, we didn't put him on testosterone or anything. We optimized some basic kind of nutrients, and talked to him about nutrition a little bit more, because he was more so not eating much protein. We kind of worked on optimizing things. And he was a VP of a big corporate hospital locally. So instead of going the hospital track, he came to me for more health optimization practice side of things. And we optimized a lot of basic stuff. And he had a lot of stress developed through that time frame. And he's like, I would not have been able to handle that stress before. I just know it would have killed me. I know, and I was able to handle that stress. And so they don't even realize how good they are. And then a big stressful event happens, and their back to baseline is a lot shorter than it would have been in the past, or they are able to survive it better, because we know sickness, we know stress, we know everything's coming. So a big goal in all this is resiliency,
boom,
resilient, building resilient humans. I mean, that's the ultimate goal in this on a daily basis. We're all going to die of something someday, but if you can really pull out the most out of each day and each year, that's what we're here to do. And that's what we're capable of. I feel like we're superheroes in that aspect of being able to pull that out for people. But any other specific examples, or kind of case studies or something that you guys have, where you had the collaboration, or had that kind of network where you're wow, this really makes a difference connecting with coaches or trainers or PTs, OTs, whoever it might be? Anything offhand? Nothing you have to be specific or anything.
I mean, this one patient of mine comes to mind. He's a 52-year-old male. When he came to me for weight loss and for testosterone, TRT and weight loss, and I ran his panels, and I was literally this close to being I'm not touching you, because your triglycerides were 400 and 440, something crazy, and his cardiometabolic markers were totally off, and he needed help. He had sleep apnea, obviously super overweight, probably by 80 pounds overweight, and I initially started him with more the foundational piece, working on his mindset, working on weight loss first. So I started him on my initial thing was, let's get you to lose a little bit of weight for the first couple months. So the first 2 months we did that, along with, I recommended him to a health coach, online health coach. He had worked out in high school, so he did have some experience. He played football, some experience with in the gym. And he started working out with this coach. I had him on a GLP-1, all the things that helped, of course, with his hyperlipidemia and everything. And then we started him on TRT. Within 3 months, he lost, I think, 30 something pounds. So I'm okay, now we threw him on TRT. Yeah. Cream. He used the cream because he had pre-diabetes, and I find that many guys do better with cream that have this insulin resistance type pattern. And he did great, awesome. And I mean, his labs are pristine. I use him as an example, and working with the health coach, I mean, he looks like a completely different human being, right? And then within a year, he got a promotion at his job. In every aspect of his life, he got engaged, in every aspect of his life just got better. He performed at a much higher level just from those changes. So implementing those changes, yeah.
Love it.
It's great.
And the confidence he probably radiates is just contagious.
Amazing. I mean, that's I love this job. You're I have the best job in the world. It's amazing. Yeah.
We got to remember those examples when we're like, oh my God, we're still doing this. How do we make this happen? You know?
Yeah.
Or when you're tired, exhausted, and drowning.
Right.
Exactly.
Yeah.
Yeah.
Victories like that.
It's great.
Oh, yeah. Yeah. What kind of examples do you have, Justin? I'm sure you have a ton.
I've got actually one that's quite similar. I had a guy that was referred to me by one of our coaches. In fact, the coach that I've been working with for 4 years, and he'd been working with this gentleman for a few years at this point. Testosterone levels, no matter what, they just didn't budge. So coach sent him my way. Lo and behold, dude was sub 200 after about a year of working with him. And I know anybody hears this be like, "What it takes to." Well, people that are in the clinical realm, like you guys, know that it doesn't work overnight. When you work with someone, you plan on the long term, right out the gates. So
Not a
after
30-day shred.
no, it
Right.
doesn't work that way. No, so
No.
Right.
realistically, so we worked together for about a year while he continued to work with a coach. During that time, body fat come down almost 8% just in that year after we started him on testosterone.
Wow.
It's impressive what you can do when you give your body the metabolic foundation. Because again, he'd been working with the coach for a few years, and his results had stalled. And I mean, the coach shares the routines with me, shares the numbers, the metrics. So I mean, we're working collaboratively very
Mhm.
well.
Yeah.
But 8% body fat in a year, that's absolutely
Wow.
that is impressive. Impressive.
Yeah.
Yeah, triglycerides, lipids, everything improved across the board. Despite, most people think that testosterone is going to make it worse, but in fact, it makes your lipids better across the board.
Better.
Absolutely.
Absolutely.
Always
Lowers
better.
triglycerides, lowers
Yeah.
LDLs,
Mhm.
increases lipoprotein lipase, increases hepatic lipase, which can shrink HDLs a little bit, but they become faster, more efficient at reverse
Mhm.
cholesterol transport. Hell, even we know that testosterone lowers LPA by about 25 to 35%. Think
Yeah.
Mhm.
so despite what people think, testosterone is one of the best metabolic drugs there is out there.
Sure.
Hands down,
Totally
in my opinion.
agree.
Hands
Hormones,
Totally
just the
agree.
hormones in general, metabolic drugs. That's what they
Yeah.
Yeah.
are.
I should do that. Do you check lipoprotein little a every
I
year? Do you
don't.
or no, not every year, but do you check it ever check it lipoprotein little a?
So I'm actually board certified in lipidology as well.
Oh yeah, I
Um,
remember that. Yeah, you
yeah,
are.
there's
Yeah.
only like 30 people in the state of Tennessee. I'm one of the 30 people that's board
Wow.
certified in lipidology. I mean, it's not that sexy. No one really cares, but
I
It's
think
I'm
it's
sexy.
pretty
cool.
cool.
I
I
think it's
mean,
Um,
sexy.
it's the number one cause of death is high cholesterol, high blood pressure forever, So
worldwide,
yeah,
absolutely
worldwide.
worldwide.
Yeah.
Yeah.
Yeah, so it does lower LPA by about 25 to 35% on average. It does.
Interesting.
That rivals PCSK9 inhibitors. So like evolutimab, like Repatha, lowers it about 25% as well. So as of right now, testosterone lowers it, probably the strongest drug out there besides an antisense oligonucleotide. Those are the newer drugs that are coming on the market that will lower LPAs more. But right now, HRT might be one of the best damn options we have for
It
improving
Really?
is.
lipids across the board.
Wow.
Even
I'll
yeah.
have to look and see because I know I check it every initial consult has lipoprotein little a on it. I'll have
Yeah.
to see
And just
my
check it like
guys
one
because I
time
never
more.
really check it again.
Right.
You'll be surprised. Oh, I should have brought some case studies. I could have brought some case
How long
studies.
after do you check it again?
Usually like 4 to 6 months later, but
6
Oh,
months.
that's
Yeah.
it?
you can see changes in. I mean, some of the changes will be contingent on if the patient's actually getting the ball rolling. You know what I mean?
Sure.
You can put them on
Yeah.
hormones. It will lower
For
it a
sure.
little bit, but if they actually like
Work
use
out
it,
and sleep and
bingo. Who'd have thought?
strength
Work
train
out and eat
and
better. Da, da,
move.
da.
Okay.
Who'd have
Yeah.
thought? Yes, you can see someone see a 25% reduction. Yeah,
Interesting. Yeah. Because I've
absolutely.
been trying to
Yeah.
follow that along and see because the lipoprotein little a, I've just checked it once, but I was like,
Mhm.
if we actually lower lipoprotein little a, will it reduce events? Do we know that
We
yet?
don't fully, that hasn't
Don't
been
we know that yet,
fully
right?
elucidated. It is considered a residual risk marker though. Like if someone's
Okay.
LDL is at target, if their ApoB is at target, but if it is still elevated, it does increase the risk of clots, aortic stenosis, and possibly MIs or CVAs. So we
Would
know
they?
it's a residual factor right now, but absolute induction of events, it hasn't 100% been fully elucidated though.
Oh, interesting. Yeah. I
Mm.
remember in a previous telemedicine clinic when people would go on things like Anavar and stuff, it would crush their lipoprotein little a. Like it
Mm.
would I don't know the full, I mean, I can probably piece out the full mechanism, but it has to be still with the liver because things like Anavar and stuff would be processed through the
Sure.
liver. So I would imagine LP little a, of course, is added to the cholesterol there. So it just would crush it down. So there has to be something in that steroidogenesis pathway that crushes it down.
if I'm not mistaken, well, we know testosterone it can stimulate hepatic lipase, which is an enzyme that's active in the endothelium of the hepatocytes. So whenever that comes into contact with like HDLs, it strips the HDLs. It strips them, thus making them smaller. So if you pull out the phospholipids out of the HDLs, they go from big, buoyant HDL2s to smaller HDL like threes, smaller ones. Um, but that, a lot of times you'll see that number reduced on paper by about 15, 25%. But what we know is like from a testosterone standpoint, the HDLs get smaller, but they're faster. They turn over faster. So in terms of cholesterol efflux, they're picking up lipids from macrophages a lot faster. Um, so even though they are reducing, it's speculated that they're actually more efficient at picking up cholesterol and taking it back to the liver for disposal. Now, in terms of
Interesting.
like what happens with illegal
Yeah.
substances,
Yeah.
I'm not
You
going to
don't know that
extrapolate that.
yet.
Yeah, I'm not going to
But
extrapolate that you get any kind of benefit from that.
yeah, no, I wouldn't like, I definitely wouldn't recommend doing that. But it's just like the correlation of like that and cholesterol. And when you look at the whole picture, when you look at testosterone, looking at cholesterol, looking at thyroid, and you see how they all connect, then you start
Oh,
learning the
absolutely.
mechanisms and like kind of seeing, oh, like why did that happen? Oh, does it happen with testosterone and stuff too? That's
Mhm.
really interesting.
Yeah.
So yeah,
That's
maybe the lower HDL really isn't any, not that we can't say it fully yet, but maybe the lower HDL with testosterone therapies isn't like a negative thing per se, but you still see the HDL LDL ratio. So looking at the ApoB, like connecting the dots with all that. Okay. Yeah.
Yeah, it'll lower ApoB across the board as well. And
Yeah.
Obviously LDL, because LDL's what is it made from? It's made from ApoB. What is VLDL?
Mhm.
It's made from ApoB. So I mean, if you lower one, the other one's going to come down
right.
concomitantly
Absolutely.
as well.
Absolutely. Sometimes I'll like optimize like for a female wise, I'll improve like thyroid function, improve their hormone function like through their like
Hmm.
perimenopausal menopausal transition. And I look at
Sure.
their cholesterol, I'm like, did I put them on cholesterol lowering medication?
No.
Or like
Mm.
I like I have to double check sometimes
No.
like that. I was like, I
Thyroid.
really don't think I did, but yeah, like you just improve that's why you like improve that first, improve like the cholesterol, improve the
Bless
hormones
you.
and then also the
Thank you.
thyroid and everything else tends to fall in place. Like everything is so connected that you have to
It
look
is
at
so
it from this whole
connected.
picture.
Sure.
Yep.
Hmm. Hmm.
And no, those are great examples. I know we have like 1,000 more examples. I think that's something that's what I love about this too, is like just the communication, just like the talking and learning these little pieces because they're only going to benefit our practice in general. And I'm sharing like different case studies, and I don't think that's really out there too much in this type of space of just kind of a collaborative, like roundtable discussion of everyday clients that we take care of.
Definitely. I look forward to the future.
Yes.
Everything we're going
Yes.
to
Hmm.
do.
Hmm.
Absolutely. Well, good. What else? Anything else to kind of like chat on real quick? This is just kind of like a quick, like, hey, here we are. Like, we're here to take over the world, man. Like, I really feel that. I'm such a visionary that I'm like, this is like huge. And it's just like as we build that momentum, as we build that through, um, it will only catch on fire. And I think the impact that we can completely make is not only like on our patient at the end of the day, but on each other, like feeling like we're not alone in like our isolated little offices, here and
Yeah.
there. That we do have people that support us, that we do have people that think how we think, and build that community that has been lacking in this white space that is out there that now we can
Mm.
name and
Right.
landed on Society of Health and Human Performance Medicine. So I think it sounds really cool. Like I'm
That's
like,
cool.
that's a really cool club.
Cool. I love it.
I don't know. That's what I
Yeah, I
think.
dig it. It's awesome.
Well,
But cool. Anything else to say or anything to do? I think I want to definitely do more talks and chats and like kind of keep I know we always are so busy, so to kind of
right.
collaborate together, we'll figure out like a time and things how to do that.
Nice.
But anything else to kind of add in on kind of a message to say to people that are interested in doing this too or coming along with us? I think we said a lot, but
I think we said a lot.
I did.
I mean, this is the way of the future, right? Everything's collaborative. I mean, we're not going anywhere, right? Health optimization, health wellness, performance. Everyone wants it. It's the thing. Everyone's into it.
Yeah.
We're just going to make life more, we're going to help everyone improve their health span, right? So
Exactly.
that's what
And
we're
you can't
here.
just go buy that at the store. Like,
Yeah.
You can't just go buy
Exactly.
it. So you have to be able to live it and have somebody to help you be accountable for it.
Awesome. I have to hop on a call. I have a patient in the next 2 minutes, so I have to
Okay.
go. But it was awesome, guys.
It was wonderful seeing you.
Thank you. Good seeing you guys. I look forward to our next.